Through Aram, we learned that early childhood development is probably the best entry point.
The approach created an excitement, giving them a new narrative that it is possible and feasible.
This actually creates a bond between the parents and the child.
What did we do differently was we looked at the existing system and we revitalized the existing system using ECD.
When we started at that time, we probably never expected that this would scale so fast.
How did you think you could address this challenge of looking at programming at scale?
We started very small. UNICEF gave us the platform, and today this program has been accepted all over Maharashtra. That means we are reaching to 125 million of the population in Maharashtra.
Welcome to UNICEF Talks. Today, as part of the celebration for contributing to children's rights, we have an interesting journey of how early childhood development has been scaled in Maharashtra from 2 districts pilot to statewide as Aram, in partnership with one of the lead medical school, MGMIS Sevagram Varda. Today, Aram is a flagship of the government of Maharashtra, which is reaching more than 40 million children, and it is through the existing system. It's across the state, and this is something the state is all proud of. So I think it's an opportunity for us to come together to take this on scale and also demonstrate changes happening within the system. So I would take this opportunity to request Dr. Subodh to speak about Aram and what has been the journey of Aram in Maharashtra. Thank you, Dr. Subodh. Over to you.
Raji, the last few years when we did Aram, those had been amazing for us, the whole team. Our dreams have come true. You know that our focus has been on early childhood development for a very long time, but UNICEF gave us the platform. We started very small with 10 blocks in 2 districts of Maharashtra. When we started at that time, we probably never expected that this would scale so fast all over the state. But it was accepted for scale up within a few years of being started. And in this process, we have learned a lot. We learned the implementation, how we can utilize existing opportunities within ICDS, health and other sectors. You know that ECD is truly multi-sectoral in nature. It requires a whole of society and whole of government effort. And with UNICEF's help, it was possible for us to actually realize our dreams of how early childhood interventions could be placed within the system and in a state so large as Maharashtra.
What was your challenge of when, as a medical college which largely looks at research in a very small population, to take up implementation science of ECD? What did you envisage as a challenge that could come to you, and how did you think you could address this challenge of looking at programming at scale?
Raji, as you are aware, medical colleges, they are involved in research. Usually, implementation research does not happen so often. At Sevagram, we are very proud of our community connect and community-based interventions, and we had been engaged in this for several years. But an implementation at such a scale we had not done earlier. This was the first time when we were doing intervention in more than 1 million population, even during pilot. And today this program has been accepted all over Maharashtra. That means we are reaching to 125 million of the population in Maharashtra, almost more than 2.5 million children being beneficiary. And in this process, we have learned a lot.
So I think very interestingly you brought this point out, Dr. Subodh, is that as a medical school, you are not geared to look at large scale even pilot. So the pilot itself was big for a medical college, and that really gave you the whole impetus to scale up Aram across the state of Maharashtra. What do you think, Dr. Subodh, was your biggest contribution to this whole ECD scale up? That will be very interesting for people to know who want to implement ECD at scale. So, your lessons will help us in taking it forward.
Through Aram, we learned that early learning or early childhood development is probably the best entry point when we move ahead. So till now, we have been doing lots of programming in nutrition and health, and we were talking to parents about nutrition and health. But when you talk to them about a simple thing like play and communication and loving their children, this actually creates a bond between the parents and the child. When we talk to them regarding child development and how these simple interventions could help their child reach their full potential, they value this information and they connect with the program. So we have started feeling that actually all other interventions related to health and nutrition could ride over early childhood development interventions. Also, there are so many collaterals when we are doing early childhood development interventions. We created a whole environment which was aspirational and appreciative, and this actually motivated the frontline functionaries, their supervisors, and whole system. They started owning the program, and with that sense of ownership, a lot of changes we could see, not only with early childhood development, but when they are doing other interventions, other works within the system.
Very interesting point, Dr. Subodh, and like the way you connected, saying that what did we do differently was we looked at the existing system and we revitalized the existing system using ECD, and that really helped in the whole magic that you keep saying in every discussions, that what did ECD do? The approach created an excitement, a kind of giving them a new narrative that it is possible and feasible. So what is it that Dr. Subodh, you and your team did maybe to strengthen the mothers meeting or home visits that would really give meaningful support to the program implementation? So if you could throw some light on that, it will help us to really say that we have platforms and we need to strengthen them.
In this process, we have realized that there are lots of opportunities within the existing system. And in Aram, first of all, we mapped all opportunities and we weaved the ECD interventions within those existing opportunities. And this was done in a participatory manner. So initially we sat with them, the district level authorities and the supervisors and frontline workers, and understood what are the opportunities. And yes, we identified several opportunities within that. It was simple restructuring within those opportunities that we had to do. For example, tech home visits. Already there was provision for home visits. But the capacity of Anganwadi workers or Asha for home visits was not adequate, and they were not able to customize messages to the needs of each family and each child, and again strengths of each family and each child. So we identified this and we built their capacity for customizing messages for the strengths and need for each family and each child. So in Aram, actually, earlier during home visits, the frontline functionaries would mostly talk to the mother or the parents. But we also identified that engaging the whole family was very important, and therefore a simple instruction that the frontline functionaries should engage with all family members, including the grandparents, the uncle, aunt or siblings, that was extremely helpful. Together they could nurture every child. Take another example of mothers meeting. Though there was already a circular on mothers meeting and this was happening within the system, but adequate effort on capacity building of frontline functionaries for mothers meeting was not done. We started working on their capacity. One principle that we adopted was demonstrating each and every activity that we expected the frontline functionaries to do. A simple thing that another frontline functionary would demonstrate these activities to the trainee supervisors or frontline workers. And when these supervisors and frontline workers saw another frontline functionary do that activity, they had to believe that this is possible within the system. The training was also experiential and hands-on. It was joyful, it was appreciative and participatory. And this helped us a lot. This helped in creating excitement. This helped in the frontline functionaries and their supervisors own the whole program. We included a very simple strategy of parents' fair for community norm building, and we learned this only from the existing system. One of the CDPOs was already doing parents' fair for another purpose. We repurposed that parent fair for to empower parents for how to play and communicate and nurture every child. And utilizing these existing opportunities and something we learned from the system and what was existing actually resulted in the magic that we are able to see.
Very interestingly, Dr. Subodh, you brought out the whole approach of training and capacity development through a consultative process and all. We knew that there is a science behind it, that why we need to really talk about nurturing care and why we need to really look at, nurturing and nourishing young bodies and minds. This is what we believed in. But the science spoke about the touch and affection, stimulation that leads to brain wiring. How did you translate this science to families and communities that they understand why they need to spend time with their child, why they need to interact with the child, why they need to show affection to the child, and why they need to really look at a responsive feeding? Why is it important? So how did you really take this science to the people in a way families and communities could see that brain wiring is very important through the whole stimulation process? Can you just throw some light on that?
Our team designed simple activities and a simple game of brain wiring that we do with a bundle of ropes, and that helped. So through this game, it becomes extremely easy to translate the science of brain wiring for people to understand. And when they understand how simple interventions of play and communication could result in such gains when a child becomes adult, that helps. It has been a wonderful partnership with UNICEF. UNICEF brings in global knowledge and experience on nurturing care framework, and this added with the state level advocacy, and it's not only state level advocacy but the kind of connect you have at district level and even with the mid-level managers and frontline functionaries and their supervisors had been extremely helpful in moving from pilot to scale.
Thank you so much, Dr. Subodh, and would like to reiterate, this has been a beautiful journey of partnership that contributed to change, adaptation and transformation. And without this partnership with MGMI, Sevagram, with you leading with your team and government, perhaps we would not be where we are. And today, Aram is a flagship program of Government of Maharashtra, which is fully funded by them with a complete ownership. You go to any part of the district of Maharashtra, people do speak about Aram. And in the journey, what you did was created champions of change of ECD who are now moving around as ambassadors. I think that has been a major contribution by Aram to the state of Maharashtra. Thank you so much for giving this opportunity for this conversation on journey of Aram in Maharashtra.
Thank you so much, Raji, for giving us this opportunity and trusting MGIMS Sevagram with this huge responsibility. We have learned a lot in this process.